Hello, so I'm Sue O'Connor from the Hutt Valley DHB. We're definitely the new kids on the block. Unfortunately, we have been late joiners to this lovely collaborative. Late, but enthusiastic and fresh. Thanks for enabling us to ride the wave of your knowledge and experience. And as I was walking around yesterday looking at all the storybooks, I was absolutely blown away by what everyone's done. What lucky patients we have who are going to get benefits from all this. So we've only been on about 2 weeks. So we've managed to come up with an aim and to reduce the incidence of constipation related to the use of opioid analgesia in orthopaedic surgical patients across the Wairarapa and Hutt Valley DHBs by the 25%. I think we're in a lucky position where we've got 2 DHBs to do our work across and compare. Our scope, we're going to look at adult orthopaedic patients undergoing hip or knee joint replacements and or fractured NOF repair. Our proposed ideas, some of you might recognise a couple of them, is to do sort of combined patient and nurse education to raise the awareness of opioid-related constipation. We think there's a problem. We know we've got a problem with constipation because we've done a SNAP audit, baseline audit, so we've managed to do that last week. Focus will be on the patient journey, sort of from pre-assessment to day of surgery. So we're going to have lots of points of contact for education and assessment. So we're trying to focus on the pre-assessment clinic. We run across the DHB's joint clinics, and on day of surgery. We want to find out if people are constipated even before they come in. We like the idea of doing sort of educational posters in the ward areas, the bathroom, sort of toilet ideas that everyone else, I can't remember which DHBs, and the patient information pamphlet use. The other focus of our education is to focus on the education of prescribers and move towards co-prescribing. So direct education of anaesthetists, because they're going to be the starting point of our prescribing. Introduction of pre-printed laxative sticker. We're quite big on stickers across our DHBs. We quite like them and they're easily introduced and quite well accepted. Education of the emergency and orthopaedic doctors, and because we've got relatively confined kind of groups, it shouldn't be too hard to do. And we sort of want to come up with a sticker attached to the opioid script. So when you go and get your opioid script for discharge, be it, the junior house officer, there'll be a prompt for them to prescribe the laxatives post-discharge. Challenges, obviously, for us is joining late to the collaborative, but Prem and John certainly made that a whole lot easier for us. I'd just like to thank them for that. Late joining required the utilisation of SNAP audits, and so proposed to doing a bit more of a robust sort of audit. Standardisation of the implementation across 2 HBs might be a challenge, we don't know, and resources, like everyone said. To the best bit, the successes and the achievements in 2 weeks, completion of the SNAP audit. Our team, we've pulled together a really cool team, and able to ride on the back of your guys' wave, which is nothing to be ignored. So watch this space. Thank you.